Well, the doctor is in with a revolutionary technique that might be their newest tool in the fight against cancer. It's a gene editing treatment that apparently changes the genetic makeup of cells, transforming them into cancer-fighting weapons. Joining us to talk about it is Dr. David Spigel. Doctor, nice to see you. You're Chief Scientific Officer at Sarah Cannon Research Institute, and it's great to have you here today.
Yeah, thanks for having me, Leah.
Okay, so I'm hearing about this through the story of a 10-year-old little girl who's in 5th grade, whose father said that basically the doctors told them this was it for her. Her leukemia was out of control. They had tried just about everything, and this therapy changed things. Can you tell us about that?
Yeah, important to mention, so not a patient of mine or colleagues, but this was in Philadelphia, a story that's been in the news the last couple of years. But the excitement, as you say, is an unfortunate situation with a child with advanced leukemia. Had been through several rounds of traditional therapy and didn't look like they had other great options. And what was introduced to her at the time as a really first of its kind experimental therapy was this idea of gene editing, as you say. Specifically, it's called CAR-T. It stands for chimeric antigen receptor therapy. It's an idea of reprogramming her immune system to fight the cancer. It's an exciting technology. It's something that's making its way into a lot of cancer treatments now as part of experimental therapies. So in her case, she had an excellent outcome, and that's been the story for a lot of patients like her.
And so from what I'm understanding, this essentially causes her own cells to become like smart cells and essentially detect and kill off cancer. Is that correct?
Yeah, kind of to make it a little bit more simple is if we think of our immune systems as being kind of an army of cells out there, we'll call these T cells that help fight off foreign things like cancer or infection. The idea here is to take those cells out of her body or patients' bodies and reprogram them. That's the term for gene editing. Reprogram those cells to identify cancer, put them back into the body in much larger quantities so that the army has expanded, and then see if that can fight the cancer. It's been an early story over the last couple of years, but the early results are quite promising in leukemia and lymphoma. We've seen a couple of years ago in melanoma, and studies are now getting started in other cancers like ovarian cancer, breast cancer, pancreatic cancer. Very exciting story. We, at our center in Nashville, just 6 days ago, opened a trial in the community for patients with lymphoma. So very exciting time.
And so this is going to require some investment from the FDA. What is it going to take to make it approved for a wider group of people?
That's a great question, because when you see benefits in over 90% of patients with very difficult situations, it's hard to not want to get these drugs out there, or these treatments out there right away. But it's going to take more studies to understand what tumor settings, what are the right patients, and these therapies can come with side effects, and so they have to be managed very carefully, studied very safely before they could be released at a broader level.
Okay, and switching to a different subject, but also on cancer, scientists are now saying that they found evidence that links people's genes to cancer. What are we learning from this new study?
Well, we've always known that there's a genetic link to a number of cancers. The big struggle is identifying whether a particular genetic abnormality in an individual, say at an early point in their life, is going to lead to the development of cancer. So we know for several cancers there's a high risk with certain genes. I guess the one that has caught a lot of attention over the last several years has been what's called the BRCA or BRCA genetic alterations that lead to an increased risk for breast cancer and ovarian cancer. So understanding more correlations like that, if you have this genetic abnormality at birth or later in life, is that going to lead to the development of cancer? A lot of work still in that area. We're learning it's a combination of those genetic risks and probably environmental risks as well. So it may not just be one thing that leads to the development of cancer for the majority of people.
And so researchers at the Washington University of Medicine in St. Louis said that they actually found ties to a patient's germline, between cancer and a patient's germline. Can you explain what that means?
Yeah, well, that's just a fancy term for genes or DNA that was something you were born with. So something that wasn't picked up later in life or from a related like sun damage or from smoking. That's something that they were born with. And that genetic abnormality is in every cell in the body. That's what that term means.
Well, lots of new research and information that hopefully leads to a lot more people's lives being saved in the future. Dr. David Spigel, nice to see you. Thank you.
Thanks, Leah.
John?